What is the ACE Kids Act? Well, the ACE Kids Act stands for Advancing Care for Exceptional Kids. This act aims to improve on how care is provided to children across America with complex conditions under Medicaid. Some benefits that are included in this law are enabling better care coordination across providers, easing access to out-of-state care, keeping care close to home, supporting standardized data collection, along with decreasing Medicaid spending. So overall, this act helps families all over receive the care that their children need without additional stress.
On December 11th of 2018, the House of Representatives passed the ACE Kids Act. And then moving to April 2nd of 2019, the Senate passed the ACE Kids Act. After the House of Representatives and the Senate passed this act, it was then signed into law by President Trump on April 18th of 2019. However, the ACE Kids Act will not be implemented until October 1st of 2022. At this time, this act will then enable better care coordination across providers for those children on Medicaid with chronic illnesses.
Occupational therapy is actually mentioned by name in the bill. When it's fully implemented in 2022, the ACE Kids Act will give states the option to provide therapy services in the care of children with complex medical conditions on Medicaid. This bill will provide health homes for children to receive coordinated care, which includes teams of healthcare professionals all collaborating on an individualized pediatric, family-centered plan. This includes pediatric emergency services and social support services. It also makes mental health services a lot more accessible to children with chronic conditions, and this is very important because children with these complex medical conditions are more likely to have lower self-esteem. Overall, the ACE Kids Act improves healthcare outcomes and supports the client-centered treatment that occupational therapy was founded on.
My name's Storm, and I've been battling leukemia.
My name is Emily H., and I was born with cerebral palsy.
My name is Emily, I'm 13 years old, and I have congenital heart disease.
Hi, my name is Emily and I am 9 years old. I have epilepsy.
I heard my mom and dad talking the other day about how much money goes into buying my medicine. My mom didn't look too happy.
I used to have a whole bunch of doctors, and sometimes they would tell us different things about what's good for me.
I have so many different doctors for everything that I need. I take a lot of prescription medications for some of the issues that I have.
Because of my condition, I have to have many doctor's appointments. My parents used to have to take me on long car rides in order to get to my doctor's appointments. I do not like long car rides. And because of these appointments that are far away, it caused me to have to miss school all the time. I don't like missing school because it takes me away from seeing my friends as much as I normally can.
I think they called it the ACE Kids Act. Once the ACE Kids Act was approved, my medicine's been much easier to buy. And since then, my parents seem to be much happier.
But under the ACE Kids Act, I've seen all my doctors come together to support me. My physical therapist, my occupational therapist, and my speech-language pathologist. They all work together to help me walk and talk better.
And so when we found out that the ACE Kids Act got passed, it was really exciting because now I found out that not just my family is going to get help, but families all over the country will get the help they need and the kids will get the care that they deserve.
Now, my parents told me about a new act called the ACE Kids Act. Because of this act, I am able to have all my doctor's appointments close to home, and this doesn't let me go on long car rides or miss school.